Taking care of your liver is important, and we have two ways to do it. We can either avoid things that harm it or use proper methods, including medicines, when damage has already occurred. Personally, I focus on prevention, so in today's episode, I'll talk about what harms the liver and what you should avoid. Let's start with mycotoxins, which are toxins produced by mold. These are especially dangerous for the liver. The two main ones to watch out for are aflatoxin and ochratoxin. These toxins are often found in foods stored in poor conditions, such as nuts, especially peanuts, Brazil nuts, and pistachios, pumpkin seeds, corn, dried fruit, sprouts, and spices. The problem with these toxins is that they're very hard to remove, even with high heat. That's why it's important to store these foods properly at a cool temperature with low humidity. To reduce the risk, I recommend buying sealed packages of nuts, seeds, and sprouts instead of buying them loose. Loose products have a higher chance of being contaminated unless, of course, you buy from a trusted seller who stores them properly. It's also a good idea to consume these products regularly instead of keeping them for a long time. The shorter the storage time, the better. If you notice strange smells, tastes, or appearances in these foods, it's best to throw them away instead of risking your health. And remember, if mold is present, throw away the entire package, not just the affected pieces. To give you an idea of how serious aflatoxin can be, studies show that it causes around 155,000 cases of liver cancer worldwide every year. Another harmful toxin from mold is patulin. This one affects the liver and kidneys and is usually found on rotten apples and pears or products made from them, like fruit purees, compotes, and juices. Eating a single moldy apple probably won't cause serious harm, but it can lead to food poisoning with symptoms like stomach pain, nausea, and constipation. However, frequently eating spoiled fruit may increase the risk of liver and kidney diseases, including cancer. Be careful with mushrooms. Since we're talking about mold, let's also talk about toxic mushrooms. You may have heard the joke that all mushrooms are edible, but some only once. This is because some mushrooms contain deadly toxins. If you like collecting wild mushrooms, be absolutely sure that the ones you pick are safe. If you are unsure, take them to a sanitary and epidemiological station where experts can check whether they're edible or poisonous. Being cautious with mushrooms is crucial because toxins in poisonous mushrooms, like amatoxins, can cause severe liver failure. In many cases, a liver transplant is the only solution. Vitamin A. Too much can harm your liver. You might not expect this, but taking very high doses of vitamin A can damage your liver over time. Excess vitamin A gets stored in the liver, which can cause inflammation and swelling. If this continues, it can lead to more serious liver problems. Luckily, early-stage liver damage from vitamin A can be reversed, but only if you reduce your intake in time. The most common cause of vitamin A toxicity is taking too many supplements or using high-dose medications for skin conditions. Experts warn that taking 40,000, 100,000 IU, international units, of vitamin A regularly can be harmful. But even 25,000 IU has been linked to liver damage in some cases. This proves that more isn't always better, and taking excessive amounts of certain vitamins can cause serious health problems. If you take a lot of vitamin A for any reason, it's a good idea to monitor your liver health by checking liver enzymes and bilirubin levels through medical tests. Medications and liver damage. Another major factor that can lead to liver problems is the long-term use of certain medications. This issue even has a name, drug-induced liver injury, because the liver is the main organ responsible for metabolizing, processing drugs in the body. One of the most common causes of liver damage from medication is the prolonged use of antibiotics and painkillers. This includes non-steroidal anti-inflammatory drugs, paracetamol, metamizole, a painkiller that contains an active form of hyaluronic acid. Overusing these medications can seriously affect liver function, sometimes leading to liver failure. Other medications that can harm the liver. Aside from antibiotics and painkillers, some other drugs can also increase the risk of liver damage. These include proton pump inhibitors, PPIs, such as omeprazole. Studies have shown that long-term use of these drugs may lead to fatty liver disease. Certain heart medications, for example amiodarone, which is used for heart rhythm disorders, has been linked to liver damage. Methotrexate. This drug, used for treating autoimmune diseases and certain cancers, can cause liver inflammation and even liver failure if taken long-term. Final thoughts. If you take any of these medications regularly, it's important to monitor your liver health and consult your doctor about possible alternatives. Long-term use of certain drugs can have serious consequences, so it's always best to use them only when truly necessary and under medical supervision. How tattoos can affect liver health. Getting a tattoo may also pose a risk to your liver, but only if it's done in unsterile conditions. If hygiene isn't maintained, there's a chance of being infected with hepatitis B or C, viruses that cause serious liver disease. For example, a 2012 study found that people with tattoos have a 48% higher risk of hepatitis B. These viruses can lead to chronic liver inflammation, liver damage, and even liver cancer over time. I'm not saying this to discourage anyone from getting a tattoo. My goal is simply to remind you to be careful and to make sure that the studio follows strict hygiene standards. If proper sterilization is maintained, tattooing is completely safe, something confirmed by scientific research. Diet and liver damage. It's no surprise that what we eat has a huge impact on our liver health. A poor diet is one of the biggest causes of fatty liver disease, which affects about 30% of adults and is becoming more common in children, with 1 in 10 kids now affected. Fatty liver disease isn't caused by eating fat alone. The real culprit is excessive carbohydrate intake, especially sugar. When we eat too many carbs, the liver converts sugar into fat, which then builds up and leads to liver damage. The worst offenders include sugary foods, milk chocolate, sweetened cereals, fruit yogurts, sweetened cocoa, and jams. High fructose products, foods and drinks with added fructose or glucose-fructose syrup, sugary drinks. Studies show that regularly drinking them increases the risk of non-alcoholic fatty liver disease by 40%. It's important to note that natural fructose found in fruits and honey is not harmful. Research confirms that eating fresh fruit does not contribute to fatty liver disease. Other foods that harm the liver. Aside from sugar, other dietary habits can also contribute to liver problems. Refined wheat products, eating too many processed flour-based foods can worsen fatty liver disease. Excess salt intake, consuming too much salt, especially from processed foods, can increase the risk of fatty liver by 25 or 32%. Foods high in salt include fast food, salty snacks, chips, salted nuts, crackers, canned meats and fish, processed cheese, instant soups, and smoked products. Trans fats. These are harmful fats formed during the partial oxidation of vegetable oils. Sources include hard margarines, processed baked goods, and fast food. Trans fats can also form when frying food at high temperatures for long periods. Weight and liver health. Being overweight or obese is one of the biggest risk factors for liver disease. In fact, almost everyone with belly fat will eventually develop non-alcoholic fatty liver disease. Obesity also increases the risk of serious liver disease. Studies show that overweight individuals have a 17% higher risk of liver disease. Obese individuals have an 89% higher risk. Other health conditions that affect the liver. Several other health problems can also increase the risk of liver disease. These include insulin resistance and type 2 diabetes, high triglycerides, high blood pressure, polycystic ovary syndrome, insomnia, and sleep apnea. That's why it's important to live a healthy lifestyle to prevent these conditions, or if you already have them, take steps to manage them properly. Final thoughts. As you can see, the liver is a vital organ that's exposed to many risks. This is because it processes harmful and toxic substances while also playing a major role in fat and carbohydrate metabolism. Since the liver is so important to overall health, we should do our best to protect it by avoiding the risks I've discussed today. That's all for now. Thank you for watching, and see you in the next video.